couple other announcements before we jump in. We are using a training environment today and the rest of this training session. This is not going to fully mimic what the live tool will look like, and that's because we're using de-identified data from a specific point in time, so things are not up to date, and there are some features and functionality that may not match what the final tool will look like. Again, we're ironing all of those pieces out, and it may look slightly different once you get the final tool. And you know, needless to say, once the final tool is out, you will be getting all of your data and it will be up to date. But for the training session, it is all de-identified and from just a short portion of time. Throughout the training sessions, really encourage you to put any questions that you have in the chat feature. So we have Dylan and a couple others helping today with answering questions, and I'll be coming over to look at the chat box throughout the session as well to make sure I'm getting all of your questions answered. I do also want to call out that the CCT administrator email address changed a few months ago to tencare.cct@tn.gov. So please make sure that you are checking your inbox for emails from this email address. It has a lot of good information on what to expect from training, getting access to the new tool, how to you know, fill out forms, and you know, just a lot of great information you're going to need. So please make sure you're checking those emails regularly. All right, so onto the agenda. So today's session, we're going to be focusing on the member panel. So this is going to be looking at how you can quickly identify all your new members, understanding your member panel, and segmenting out your member panel for things that may help whittle down into specific populations. So searching by demographics, medical history, health plan, and a lot of other things. So it's a bit more of a macro level view of your members today. So with this, I'm going to go ahead and switch over to the tool. So as you would have seen last week in the CCT 101, this is the login page. And I'm going to be logging in as a practice administrator. So this will be slightly different than what care coordinators will have access to, since practice administrators have the ability to see a few different reports, which we'll go over Wednesday. And practice administrators also have the ability to assign care coordinators to members. This is also a bit of a different view of what our MCO partners will be seeing. They have different screens for their reports, and we will go over those on Wednesday. So logging into the tool, the majority of you will see this, what we call the care dashboard. And it looks like somebody is having trouble hearing. Dylan, can I just do an audio check? Are you able to hear me?
Yes, Allie, I am able to hear you.
Perfect. Thank you so much.
You got it?
Okay. I am good. Thank you. All right. So this is our care dashboard. This is going to be the first thing the majority of you see when logging in. And it's going to give you that quick snapshot that Dylan had gone over last week with a lot of different widgets. Today we're focusing on our member panel. So this is the widget that I'm going to be focusing on today, our total members. So when drilling down into the total members, it's automatically going to pull up your new members. So again, since this is not up-to-date data in the training environment, we do not have any new members. But what you would see is any new members who had been attributed to you within the past week via the attribution files, they would list out here. So just as a reminder and maybe new information for some of you, TennCare receives the attribution files from the MCOs every Friday. So this information is updated weekly. So any new members would be showing from the past week's attribution file. Excuse me, you can also choose enrolled, and this will show you all your existing and enrolled members. So you can see once that you choose enrolled or new, it's just going to auto-populate for you. You don't have to actually click search for anything. Once it's populated, you can see there's a lot of different information that's going to display. So you have their status listed, which is going to be enrolled for this section. They'll have their last name and first name, their date of birth, their age, and this is something that was specifically requested a lot by our pediatric population. We know that it's a bit easier to do the math on having the age to know when somebody is due for a well child visit or a specific immunization if you just have the age there. So we heard you and we added that. We also have gender, member's health plan, the member ID, and another thing that we heard is 10-care IDs were not helpful for the practices, so we are using the MCO member ID here. You also have care coordinator. If there is assigned care coordinator to the member from the organization, that will list out here. Care coordinators, again, are assigned by the practice administrator. So we know that some practices do not assign care coordinators, so this would just stay blank until you decided to assign out members to specific care coordinators. It will also show a member's assigned provider or their PCP, has the member's phone number, their risk level, and any chronic conditions that the member is listed to have. So you can see here that a lot of these individuals have this triple dots. So if you click on the triple dots, it will display all of the different chronic conditions that are listed out for this member. Now down here, you can also decide to increase how many members you see per page. It defaults to show 10 members a page, but you can choose up to 100 and then it'll update how many are showing and it brings the pages down to 8. You can also export into Excel. We know a lot of practices like to export into Excel so they can do a lot more data manipulation. So we have this over here on the right-hand corner, export to Excel. And I'm just going to click this so I can show you all what that will look like. Okay, so this is what the Excel spreadsheet will look like. You'll get the same columns of the status, member name, date of birth, age, gender, health plan, member ID, any assigned care coordinator, the assigned provider, risk, all the chronic conditions, and their phone number. And from here, you can manipulate the data as you need for your specific workflows. Okay. Any questions so far on drilling down from the care dashboard widget, looking at enrolled or new members? Okay. So we're going to go over to the second place that you can see your member panel. So again, the care dashboard is the first place you're going to see once logging in, but you can also go to the left-hand menu. Under care management, you can search, choose the member search section, excuse me. So the member search section is going to help you do more of the filtering down into smaller populations of what you're looking for. So you can drill down into a specific member. If you have a member you're looking for, you can search by name. If you click on this eye icon, which means more information, it will give you all the ways that you can search for a specific member. So you can search full last name, full first name, full last name, partial first name, partial last name, full first name, etc. So there's several different ways that you can search for a member specifically. You could also search by a member if you know their MCO member ID number. You can search by their date of birth, their social security number. So any of these will give you a specific member if you have that detail. Now, some of these other search features are great when filtering down to just a larger population and not quite down to a specific member. So you can search by health plan. You can search by the program. So most of you will have just one program you're looking for, but if you know that you're working with an MTM program and you're searching for a specific member section of the MTM program, you can choose that. You can also then select, once you choose a program, if you want to filter down even farther into a specific risk population. So you have the choice of searching for the high and critical, the medium and high, moderate, or low. This I'm going to go ahead and click high and critical. There's also the beneficiary status, which is active, unless you're specifically looking for somebody potentially who's been deceased or terminated. The program status, for PCMHs is always just going to be active, but this can be really helpful for our THL programs who are maybe searching for the attributed not enrolled or inactive no BH treatment to do some specific targeted outreach. If you are a THL, you could choose those specific roles and, program statuses to filter down into the specific population you're needing to do outreach on. You also have the ability to search just by gender. You can search by specific chronic conditions. You can select by a specific assigned care coordinator for your organization if you're trying to see just your members and you know that you've been assigned to them. This is where you could go to whittle it down to your specific member list by choosing your name here. You can also search by assigned provider. If you wanted to search by all the members for a specific physician, you would just come in here and search for that specific individual that you were looking for. So I'm going to go ahead and choose one of these individuals. You can see there's all of the providers for this organization would be listed out, and you would just choose the one or multiple individuals you were looking for. So once you've chosen all of the search criteria you are looking for, and you can select all of them if you need to, you would just click this magnifying glass to initiate the search. And you'll see that it shows that loading data while it's processing the request. And unfortunately, I've filtered down a little bit too far for our training environment, so I'm going to go ahead and take off the position specifically for this one. That may be what the problem is. Okay, I'll do a search again. All right, so now it's going to be listing out all of our PCMH program members that have a risk category of high or critical. And so again, the risk scoring that we use is the CDPS plus RX. So it's the same that Altruista is currently using. It's a very detailed way of finding the risk for members, and it's based on claims and prescriptions and a lot of other things. So if you're interested in learning more about what those specifics are, I can put that into the chat box a little bit later today. All right, so from here we have 234 members that we've whittled down to. There is a way to do a more advanced member search and really tailor it to what your specific workflows are. So let me just dive into that. We'll click the advanced member search. So from here, you can choose a number of different items to search by. You can select an age range. You can select race, ethnicity, county, zip code, diagnosis date, diagnosis, prescription date, medications, service date, and procedure. So we know from some of our larger organizations, having the county or zip code can be very helpful when trying to parse out the population to specific areas. So for this demonstration, I'm going to choose county. We're going to title this our county search. So for this, you would then choose which county you're looking for. Because this is a training environment, this is actually giving us some fake, areas. We're going to use New Jersey and then Middlesex County for our individuals. In the live tool, you'll have Tennessee and then the Tennessee counties. So you can save this search for future use, and you can save and select, which means it's going to go ahead and get it populated for you down here. And I'm going to hit the magnifying search button again to whittle it down. It always takes longer when you're sharing screen, so I apologize for the delay. So this, again, with the training environment, everybody is in New Jersey and Middlesex County, so it didn't actually whittle down our population much more. If we wanted to whittle it down to maybe some specific chronic conditions, we can come up here to chronic conditions, and maybe we're looking for our members that have, sorry about that, have asthma and an anxiety disorder. All right, you can see we went from over 200 down to 142 members. So we scroll back over here, we can see that all of these individuals have asthma associated with their chronic condition profile. However, it might not be just asthma or anxiety. So again, we have these triple dots for some of the individuals. We can click on this. We see that this individual has anxiety, anemia, bipolar disorder, learning disabilities, or other developmental delays. So there may be more than just the asthma or anxiety disorders. And when you're doing these chronic searches, this is not just filtering out down to those individuals who only have asthma and anxiety disorder. It would be any individual who has asthma or anxiety disorder, in addition to potentially more chronic conditions, as you can see with some of the individuals with the triple dots here. So again, this is a good way to whittle it down to a specific population you're searching for, and you can export again and do whatever outreach that you're trying to complete. With this screen, I will also point out that there's a primary care coordinator and a secondary care coordinator. And we know that some organizations like to have 2 care coordinators for a member. So there is the potential for the practice administrator specifically, to assign to more than 1 care coordinator for your organization. And again, that is based on your workflow. You don't have to do this, but we do know that some organizations like to have that feature available, and you can assign up to 2 for your organization. Okay, so looking over at the chat box, and I've seen a question: how will you know who's been assigned a care coordinator? That's a great question, Dorothy. So if a member has been assigned to a care coordinator, it would show here, either the primary or the secondary. Another way we actually have had questions on if any of the assignments from the current tool with Altruista will come over to the new tool. And yes, we are working on having those assignments come over to our new tool. So the way that they are assigned in Altruista, there's a start and an end date. So they're either active or inactive. Anything that's active beyond the date of that transfer this month, it will populate here in the new tool. So you wouldn't have to reassign. If there were assignments that had shown to be inactive or ended, those will not transition over. So those individuals would need to be reassigned to a care coordinator if the practice administrator is looking to do that for their organization. Again, we know that some organizations don't use that feature. Hopefully that answered your question. There's a question on how high and critical are determined. So that's a really good question. That goes back to that CDPS plus RX. And it's a pretty complex formula. We do have a PowerPoint presentation that I can share with you all. So it's on our CCT learning page. TennCare. If you just Google TennCare CCT Learning, it'll bring up the care coordination tool. And we have a lot of different information here. So if you're looking for all of the information on, let me just stop sharing so I can pull this up and get it more quickly. On the CDPS plus RX, we can definitely get that to you. I will put the link in the chat. It has some pretty good information in there that can be really helpful for organizations. So, all right, I've just placed it in the chat. Okay, are there any other questions on either the risk stratification or member search, member panel at this point? Okay. All right, so now that I have this information all pulled up, I'm gonna again show you that we can export to Excel from here. And that's where we can do a lot more data manipulation if you like. I'm not sure if that does. Let me click it one more time. There we go. I apologize for the delay. It does take a bit longer when you're sharing your screen doing this. Okay, here we go. All right, so again, you can see it's going to break it out into those similar columns. So you have the beneficiary status, their name, date of birth, age, gender, health plan, member ID, social security number, if they're assigned to a primary or secondary care coordinator, their PCP, their risk and risk score, their chronic conditions. And once you do an advanced search, it's going to show all of the different advanced search columns. So even if you haven't searched by them, they will populate these. If you're not going to be using the information, you can just go ahead and hide those columns and just focus on the ones that you're using. And just again, wanted to point out that last column is phone number. I know that's really important for all the outreach that's done. Okay. Any questions on this data? Okay. All right. So the next place that we can find our member panel is actually by going over here to that left-hand menu, and we will click on reports. This will bring up a pop-up, and this is going to take us to that 3D analytics section. Now, there's a lot of information in 3D analytics, and I'm not going to dive into it today. We're going to focus Wednesday on all of that information. So when you're looking for your practice's enrollment data, you just want to make sure you're at that practice level, and then we're going to click on enrollment. All right, and so from here, you'll have the ability to choose a few different filters for viewing the report. So if you're a PCMH, you're only going to have the PCMH selected as the coverage type or program. If you're a THL, you'd have the THL. We only have one organization that's both. You could toggle between either. You can then choose by health plan if you want to see your member enrollment by health plan. So for this example, I'm going to go ahead and select all of them. Your practice is the only one that's going to populate for the practice, so you wouldn't have to worry about that. And then you'll have the option to choose a time period. So you can go back a few years to see some of this information, but we're going to focus on 2020 for today. Anytime you change any of these filters, you will need to click View Report to have the data refreshed. All right, so again, this is all de-identified and not fully accurate data, so just want to remind everyone here on this. But for this training environment, this practice, it has looked at breaking it down by AMERA group, Blue Care, and then TennCare Select separately, and then United Healthcare. And we can see the enrollment numbers for each of these months over the entire year thus far. We can also break it down a bit further by looking over to our left. So this is actually breaking it down by member. It will show the member ID, name, their age, gender, and then their address, secondary address if they have like an apartment number or suite number as shown here. It would also show their city, their state, and then their phone number again. So you could potentially do some filtering out here if you're looking for a specific individual, you can search their name. If you're looking for a specific age group, you can put that down here, you know, the gender, and then refresh and search. You also can see over here on the right, it's broken down into members by age group and then their gender. So we can see for this training environment practice, they have 9 females who are between the age of 0 and 1 years old and 10 males. And, you know, goes all the way up to 90 plus to total their members of 28,889. So pretty big number. And again, this is for the entire year thus far. So we're now in November, so it's showing January through November. Now this information you can also export. You can export it over here, export to, and then you have a few ways to export this. So you can choose Excel, a CSV file, PDF, or a rich text format. So I'm going to show what a PDF would look like. Give it a minute to populate. Again, if you're kind of looking at what your age group is for a specific MCO or just the number you've had over the year for enrollment for each MCO, this is a good way to break that out. I'll give it a minute to open. All right, so this is what it would look like as a PDF export. Again, you're not going to be able to manipulate the data here, but it just gives you that snapshot overview of your member enrollment over the year by month and by MCO, breakout of the age groups and gender, and then each of those members and their contact information and demographics. So those who may want to do a little bit more manipulation with the data, we will also show you what it looks like as an Excel export. Oops, don't want to save that. You just choose Excel and it'll automatically start the download. Okay. Finishing uploading. Again, apologies, it does take a bit longer when you're sharing your screen.
And Allie, while that's loading, we do have one question from Ida in the chat about whether you can see this information at the care coordinator level. And so, well, I see it's loaded. So, but maybe you can touch on that here in just a moment.
Sure, absolutely. Thank you. Okay, so this is what it would look like as the Excel spreadsheet. So those who are savvy with Excel can, manipulate the data as they're able to. So it's going to show pretty similarly, but this you at least have the ability to do a bit more manipulation with. Okay. All right, so looking at the care coordinator data, so this is not where you would see information by care coordinator. This is just by your practice and then by MCO. So to look at what care coordinators are assigned, if you wanted to search members by care coordinator, we're going to go back to the CC Pro. So you can do that here in the member search, and you can choose a specific care coordinator to search by, or multiple care coordinators if you're trying to search by a couple of them. I know for our training environment, this would not populate a search, unfortunately, but let's say you wanted to search, just by these individuals, but nothing else, we would just need to clear out the other search features. And then we would search by care coordinator. And it would bring up all of those members who had been assigned in the tool to either of these care coordinators. And like I said, there's unfortunately nothing to show here, but if there were, this is where it would display. Hopefully that answers your question, Ida. I do see a question that has come in on if there will be on-site training at some point. Unfortunately, with COVID-19, we are not able to do any on-site training for the foreseeable future, so all trainings will be done virtually. Okay, and then there's another question on the accuracy of contact information in here. So that's a great question. So we get our contact information, such as the address and phone number, from our eligibility data. And, what we have in there is what we know. So it's hopefully up to date, but honestly, sometimes individuals, we just don't get their correct contact information if they've moved for a few weeks. So it's not a matter of the data loading, it's a matter of us having the actual correct data. So hopefully that answers your question. And again, just a reminder that MCO attribution data of who they're assigned to, which practice, and what MCO, that is loaded weekly sent over to us by the MCOs. Okay, and we have a question on, will the member search or analytics tab indicate if the member is a THL or PCMH participant? So yes, when you're searching here in the member search, you will be able to search by PCMH or THL. In the analytics tab, if you're a PCMH, you only have the ability to see PCMH members. If you're a THL, you have the ability to only see those as a THL. If you're trying to see if your PCMH member is also a participant or a member of a THL, yes, we can see that. And that's one thing we're going to drill down to tomorrow when we go into specifically looking at the member. So going from our macro view down to our micro view of all the detail we can find on each specific member within this tool. So great question. Okay. Any other questions on the member search or the dashboard widget or the enrollment analytics view? Okay, we have another question coming in on, let's see. As a care coordinator, I find that I'm not able to do a lot of follow-up ER hospital discharges. Does this affect care coordination negatively? So if you're speaking on doing outreach and if that negatively impacts the performance of the organization, I mean, not necessarily, you want to make sure that you're reaching out to all those individuals with care gaps, making sure that the measures, the HEDIS measures are being closed and their care gaps are being closed. but there's nothing that's saying like, you know, you're being dinged for not following up immediately after an ER. If you're talking about follow-up within 7 days of a hospital discharge, I can say there is an alert in here that will help make sure that there's a reminder to reach out after that hospital discharge, if that helps. So if there's more to this question that maybe I'm not understanding, please go ahead and type that in. All right, and as a reminder, if you're in this, one of these sections that you kind of clicked on and maybe you want to get back to the care dashboard, you're going to come over here to the left-hand upper or the right-hand upper side and click on this little grid view, and it'll take you back to the care coordination dashboard. Great. Any other questions that I can help answer on what we've gone over today? Pretty quiet group. We had a lot more questions in the first session. All right, so just as a reminder, tomorrow we're going to be delving down deeper to do some searches by members and seeing all the micro level data we can find within the tool. And then Wednesday, we're going to be going over our quality measures and the reporting. Thursday will be focused on ADTs. And then Friday, we have question and answer sessions for maybe some questions that have come up after you attended one of the trainings and just want to get it clarified. So we will have those on Friday. We will have more information coming on the release of the new CCT. We don't have a date to share with you yet, but once we do, we will absolutely be sharing that. Please remember, if you haven't already, to complete your acceptable use policy and remote access request forms required to get access to the new tool. Those have been sent out. If you did not receive one, or maybe you misplaced it and need it resent again, please email us at tencare.cct@tn.gov. I'll put that in the chat. And then as a reminder, you've probably seen in the emails that have come out, TennCare has new policies to help protect the security of members' PHI. So we have a new requirement that users of the CCT have a professional domain rather than a consumer or public domain email address. So for example, yahoo.com versus organization@organization.org. So, you know, we want to make sure those individuals who are accessing the CCT have a secure email. If you need to request an exception because your organization is extremely small and unable to have a professional domain, please email tencare.cct@tn.gov with the situation, and we can discuss if it's possible to grant an exception for your specific small organization. All right, so at this point, what we're going to do is, if you had attended last week's session, we have a poll that we will put up at the end of each session, and this is really to give us an idea on how we're doing with training, make sure we're giving you the right information at the right time. So we're going to pop up that poll right now. If you could take a few minutes to complete that, it would be greatly appreciated. And I will be here for a few more minutes for sure. So if there's questions that you're thinking of, please go ahead and put them in the chat, and I will be answering them while you all are taking this poll. So we do have a question on when will individuals get their username and passwords for the new tool? It's a great question. So those will come out later this month, closer to our go live date. So again, we don't have a specific date to give you at this time, but it'll be sometime later this month.